Hello and welcome back, everyone, to another exciting episode of IRE Talks podcast, powered by GIBS Business School, where innovation meets inspiration. I'm your host, Abhirup Mitra, unveiling the truths of the entrepreneurial world. Today, we have with us Mr. Vaibhav Tewari, co-founder and CEO of Portea Medical, joining us to share his journey in revolutionizing healthcare in India. Vaibhav, thank you so much for accepting our invitation and allowing us to host you today.
My pleasure.
So, Vaibhav, I'm sure our audience is really keen on knowing about your early life. How did it all start? Where did you study? And how was life back then?
It goes long time back. I was born and brought up in Lucknow. And I studied till my 12th year. I went from my team to IIT Kanpur. This was she was 93, I graduated. I worked for 3 years and I had my MBA from Calcutta. And then, of course, then my quote-unquote professional journey started. I worked for Citibank a couple of years in Bombay. And then I moved to Bangalore to start one of the first ventures which some of my friends were starting. And of course, I joined them, which was Seva, which was one of the first BPO companies in the country. And from then, I've been in Bangalore for now, after 34 years. So Bangalore is currently.
So, what led you to start the venture in healthcare? Because it's quite a risky field, I believe.
See, from my perspective, I have been in different industries all along. So I worked for 3 companies, and of course, this is my third venture I've been actively involved in. All I've been in different industries, and I believe that healthcare was a need of the hour when we were looking at this particular space. And our other founders, Meena Ganesh and K Ganesh, they looked at healthcare, and of course, this looked like the right opportunity to support. Because if you look at India healthcare ecosystem, India has made tremendous strides from corporate hospital, like high-level healthcare, high-quality healthcare delivery from hospitals perspective. So India had very good hospitals, world-class hospitals across the country, not tier 1 and tier 2 cities. For the last almost 25 years, Apollo, Manipal, Fortis, quite a few have been there. But the moment you finish the surgery and you got out of the hospital, the level of care post that was very recognized and was not the same quality which you expected actually. So I think when we looked at healthcare in landscape at that time, we saw outside the hospital healthcare opportunity was sizable. Need was very big. And if you see the developed markets like US and UK, home healthcare, of course, has been a big part of the overall healthcare ecosystem and the patient recovery journey, right? So these have been there for many decades and have been very established, very professionally run. And we saw that opportunity, if you can create a good service with high quality outside the hospital, the need is tremendous. It will support large number of patients in this country. And of course, can be a pan-India kind of offering as we go along. There's a whole idea of when we looked at building this particular industry.
So when you talk about quality and service, what do you think, what was the challenge, to ensure quality and consistency when it comes to having home care, home medical care at such a large scale across the country? How was it? How difficult?
So when we started, of course, at that time, the whole idea was because we were taking out this service to the market for the first time in an organized manner. The whole idea was to test each of these services in the market. So when you start, each of these services were being offered in some form or other, right? So we looked at how each of these can be taken to the market with the right quality, with the right availability. We call it availability, reliability, and quality, right? The 3 key ingredients and the 3 tenets with which we started. And so it was very important in the beginning to establish that. So of course we went and signed up with some of the large hospitals to become their partners. So we could basically, our consumers could see, our patients could see the right credibility, right? Healthcare credibility is the most important thing. So initially it was very important to work with the right partners. I established our credentials with them. Before you establish your credentials with consumers and patients, you have to establish your credentials with the partners. So we signed up quite a few of these large hospital chains, and they of course saw the kind of investment which we were making in terms of making sure the right medical quality of care we are able to provide for the patients. So we signed up these hospitals and of course start supporting their patients from there. When we build the quality of service, I think there are 2 or 3 things very critical. Even that we are looking at a distributed service across the country. Even in a city, if you look at Bangalore, this area is very different from let's say Nepal. Those are 3 different cities. This is not Bangalore. Israel is not Bangalore. is basically a combination of different locations which are like independent geographies in many ways in exist. So how do you establish a service there which basically is reliable and available? And how do you make sure that you're providing the right medical quality? So we basically invested in getting the right technology in place. We created our own ERP system so we could make sure that patients are getting the right service at the right time. So, for example, if this therapy you provide across the metro city, you need to have people in each zone who can basically handle the patients. Because somebody traveling from India to this area, you won't be able to provide the service on time, right, with all the variables being there. So you have to basically do the capacity planning properly. Technology becomes very important. It's a traveling salesman problem, right? You have to basically make sure that you are solving that from efficiency perspective. How do you get the medical data of the patients? How do you make sure that you are collecting the right way? Basically SMEs, subject matter experts, are doing it that right way, and then data goes back to the patients to know how their recovery is going on, how their recovery and their healing is going on. That's one part. So technology is a very, very critical part of building the right quality. Of course, the people, what kind of people you hire, how do you train them, how do you work with them on an ongoing basis, how do you make sure that their continuous learning is happening, right, on an ongoing basis. And third thing is that how do you create the right medical support, medical supervision infrastructure in the company. So when we started, we set up basically each region had a medical head, and you had a medical director, very senior doctor himself, who will basically set up the whole SOPs and process and everything. So you have the right training, right quality, right technology, and right medical supervision to ensure that you are able to provide quality consistent. That's something which we should look for. So Indian patients basically look for things which they can, of course they are willing to work with you because they also need some service and things like that. But they want all these ingredients to be there. They want to see you trying best from your side. So I think those kind of things which we invested right up front. And that's the reason why patients have been happy with us.
That's actually, so I think having a proper ERP system backing of proper data and a support of proper teams for variety locations and distributed locations that help the audience, right? So I just want my another question. How do you think what you're operating in 110 cities supporting over 50,000 patients on a month, what are the key strategies that led to such a rapid expansion?
So I think from our perspective, we look at if you're creating a service outside the home, what we wanted to do is home healthcare was a big part of it. The idea was to create a national brand, and idea was to work with all healthcare ecosystem players like hospitals, insurance companies, corporates, pharmaceutical companies, and so forth. So what happened? We created the capabilities. So we said we are going to have primary care, we are going to have post-operative care, we have chronic disease management, and we have killer care. So these are 4 key segments in which we created capabilities. And once we create capabilities, we took those capabilities to every ecosystem player. It's a classical go-to-market strategy, right? So create capabilities and then take it to everybody who can use it. And we saw that first consumers directly half our business come from direct to consumer, and the other half comes from B2B. And each of these capabilities we took into these partners, but all of them expected you to be nationally present, or at least present enough in a large scale area. So we created 6 regions and we basically set up our regional offices there. And from there we created satellite offices, we created some of our spoke model. Of course, a lot of learning has gone into it in the last 10, 11 years in terms of growth. So how many offices set up, how many offices support in how a spoke model from there. So I think today if you ask me, we have reached the structure, we have regional offices, we have some of the satellite offices, and then we have a spoke model. Some other cities where we don't have offices, but services are being provided with people on ground. So I think a combination of that has allowed us to reach out to these many cities. Of course, we need to have partners who we are supporting. Patient base has to come from there. So that's something which we have worked very extensively, creating the right partners, B2B partners with we can work. And because we invested a lot in technology, scaling has become easier as we have gone along. So I mean, in the original manual way of working, which probably would have seen in healthcare 15-20 years back, you can't get to so many cities. So today, you'll have a skeletal basically operating staff in each other branches. Of course, clinicians who are going to the patient's home will be there as needed for that particular city. But a lot of management, a lot of operational management will happen using technology from how by this model. So I think that is technology and a strong medical oversight centrally. And now, of course, digitalization has also helped us to basically run it a lot more efficiently. So I think those are 2 or 3 things which have helped us to
So I am pretty sure that having an idea and turning it to a reality is not that easy of a task. So what was like one biggest challenge that you faced when you started off?
I think when we started, the challenges have basically changed as we have gone along. So of course, in the beginning, it was more about proving the services, making sure that each of the services are viable, building the right credibility, right, building the right brand actually. So when we started, as I said, in the beginning, a lot of marketing efforts were going into signing the right partners, signing the right hospitals. Second, of course, we invested a lot in creating a D2C brand. Okay, and we still spent significant money on digital marketing. Basically, the SEM, SEO, we have invested significantly in that. We do a lot of B2B marketing. We, of course, have below the line marketing. We also ran TV campaigns at one stage, actually, as we are building the brand. Actually, realized that we have a national presence, and this service can be leveraged nationally. Of course, we created TV campaigns. We ran it for a couple of years. Apart from rest of the ATL and retail marketing, as we call it. And so that has been the first credibility. Building the brand have been challenges. Getting the right people has been a big hope. And right now we work with government significantly, NSEC and their other partners to create the right cadre to support this particular industry for the ability to exist. And we have trained over 30,000 caregivers in last 10 years, so with different partners. So creating the right cadre, working with the right with I think government stakeholders to create the curriculum the right way, making sure that people are able to move from smaller locations. A lot of these people come from tier 4, tier 5 towns. They will come from villages, and of course they come to big cities for a job. So how to create that environment, how we create those corridors, quote unquote, where people could come and build a career. How do you create home care as a career for a lot of these people, right? So that has been a big thing which we have worked on, initiative we have worked on. COVID has been a big black swan event in the middle, right? So both wave 1 and wave 2 very different, very challenging for the healthcare ecosystem. So that is something which we worked on. And then of course, as you are building a business, how do you run it profitably? So anybody who is building a business, trying to get profit becomes important. So I think that has been a big thing we have focused in the last few years to make sure that we are profited.
So good point that you raised. So, during the COVID, was it not difficult to get into, make people accept the services because there were a lot of barriers wherein people did not want to get in touch with outside.
Yes, so I think both wave 1 and wave 2 in India were very different. So wave 1, of course, we had lockdowns and people were very wary because they didn't know what COVID was about. And at that time, of course, so some of the core businesses, which is discretionary healthcare spends, went down significantly. Hospitals, people were not going to hospitals. So that traditional thing became an issue. You're absolutely right. So that was a big challenge in those first 6 months of lockdowns. Though what we did at that time, because COVID was a new thing and government was looking at doing something about that particular need, we worked with multiple state governments to create home isolation program. In fact, the first home isolation program we created along with Delhi government, and we launched it for Delhi patients. It was covered by Harvard Business Review as a healthcare innovation by public sector, by government and there we basically supported. So in those year and a half, we supported over 5 lakh patients in their homes under home isolation. And we worked with 7 different state governments and supported all of Karnataka, Mumbai, Chennai, Haryana, Punjab. We ran large scale programs over there where during lockdown, when we would create a team of almost 1,500 people sitting in their homes as a combination of doctors and patient care experience who are basically taking care of these patients under home isolation. So all that teleconsultation, medical piece, everything was done by us. All the on-ground support was being done by government. And while we were there, and nobody was working in the offices, right? Of course, we were working in the office because we are healthcare provider and so was government. But all our 1,500 people, we basically created that workforce in those 3 to 4 months and created nationally. And that's how it worked. So I think that became a big thing for us to focus on during wave 1. Wave 2 was very different because wave 2 was a lot about oxygen management, was a lot about beds not being available. And at that time, need for home care was very, very big. And there again, we worked with many large partners. We worked with HUL. We work with many other corporates to create this whole oxygen management services actually, where We got a lot of oxygen concentrators were given by these corporates, and we managed those for the needy patients for free because they are funded by these corporates. At one point in time, we had almost 8,000 oxygen concentrators which were with us to basically support the patients at home. So all the management of the patient after that was with us actually. We were doing that whole thing. So wave 2 was a big eye opener on what is possible with home care. And I think wave 2 also ensured that home care became like a known service, known thing for every patient. Patients will call us at that time and say, we need ICU at home because beds were not available in the hospitals. And those, like I mentioned, years were really demanding and challenging. And we did a great job at that time. So I think that year was situation very different. I think post 21 end, situation started becoming more of normal and people realize that wave 3 didn't become very bad after that. COVID effect was gone in that sense, but those 2 years basically taught us a lot in terms of how to be nimble, how to be basically thinking on our feet, how to be innovative, and a lot of that stuff we did like on our feet actually. But instead of the services that we created on our feet, nobody knew what COVID was, right? So first COVID home isolation was for 17 days. Last COVID home isolation was for 5 days. Right? So I mean, how the SOBs see, how you work with different stakeholders, how do you work with government, and many of these cases we did the proof of concept with many state governments. Along of course with different partners, AICTE, government, and so many other people who came together to take care of that thing. So it taught us a lot about how to innovate in times of crisis as a country, and of course for us as a.
So I think it was quite a learning and a lot of accomplishment as well. And now that you're talking about innovation, I just go to my next question. The technology is shaping the all healthcare services. What are the kind of innovations you are most excited about?
So there are 2 or 3 things which are seeing good trends. Of course, I think the point of care devices have picked up a lot in India. Where patients are using these to take care of their health on an ongoing basis. And of course, these are connected devices, so we are also able to track patients' vitals, patients' parameters, and are able to create customized care plan for them. So what's the biggest change you are seeing with technology coming into healthcare? Healthcare was not personalized 10 years back. Healthcare is not on personalized. Actually. I mean, there's a path forward where the way today you want Netflix or Amazon or something like that, right? It gets fully customized to your taste, to your liking, right? Because that enough data is there. Healthcare over a period of time with point of care devices, with connected devices, with AI and digitalization, there's a path forward where you can customize healthcare plans to each individual basis their specific healthcare situation, right? And I think that's a big change that you are seeing in healthcare with technology. That's the biggest thing which at least we are excited about. I'm excited about when we are seeing trends of that already on ground. I mean, diabetes management people used to go and do blood tests in the labs, right, earlier to get their readings. There are of course glucometers team, you could probably do it at home. Today you get this patches, right? Continuous glucose monitoring patches, which you can just put over here and you see your glucose levels and sugar levels full day. You exactly know where the spikes are coming, what is happening, what is not happening. So a doctor sitting at the back end can basically on real-time basis manage your health rate. Similarly, we are seeing similar trends on hypertension management now. So there are a lot of innovations which are coming into this space. I would believe that point of care devices, AI and digitalization put together will make healthcare so much more personalized in the next 10 years that you won't believe that you're still in this era also. And if you tell somebody that we had only one channel in production 30 years back in this country, and we had only cable TV 20 years back, people would believe.
Right?
Correct. So this even healthcare probably 20 years down the line would be look like that because of technology, and you can just create a plan for yourself along with your doctor, and can be treated and managed and monitored as per that. So that's the biggest change I had seen, which is very exciting. And of course, AI will also bridge the gap between the shortage of healthcare professionals in India and worldwide. The healthcare professionals required to take care of people are in short supply, or you take care of so many people. I think technology is playing a big role with teleconsulting, with telemedicine, with remote patient management. I think those kind of things are driving a lot of efficiency. AI will drive a lot of efficiency in terms of how do how do you basically leverage the same resources much better for more effective work. Efficiency part can be taken care by AI. I think there a lot of innovation happening in that space now in university. And of course, persuasion of healthcare is another one, which is tremendous opportunity.
So when you were mentioning a lot of things, it just struck my mind that obviously there are organizations or companies similar to your, organization as well in the same line of business, and obviously there are a lot of innovations that are happening. So what do you have to say about competition and how do you address it?
It is a very, very big market. Need is so big, and India is such a vast country with so much of complexity. I think there's space for everybody. I think more the merrier. So I think today you are seeing so much need for elder care. India by I think after 30 years will have 30 crore plus people who are 60 plus. So we are seeing those kind of trends. So now if you start building businesses for elder care, it's a big need which is there, right? And India is a young country, but India also is a growing country, actually, but just by sheer numbers, right? So I think there are so many opportunities in the same patient journey, from like baby care to elder life to elder care to end of life care. There's tremendous opportunities through the care continuum, right? And I think there's a space for everybody to come, innovate, and build it actually. And of course, there will be consolidation, there will be other kind of things which happens in any industry. But I think at the stage we are at, the more people look at innovating, the more people look at solving this problem. Because some of these products are unknown, so we have never solved these problems. I mean, we have not dealt with this large number of elderly ever, right, as a country. So we have to rethink the way we deal, right, in each of these situations. So for that, I think investment in this particular space will only help the country.
And just to understand, with things changing so quickly in terms of business in India, how do you think how much of it is important to come up with new ideas and ventures because of the fast changes? How visible is it?
I think the pace of change is very high. So if you see innovation also in India, probably we used to innovate once in 15, 20 years. I think we are innovating once in 3 years now. And the biggest reason for that is that data is a lot more personalized, data is a lot more available today. In your pocket now, right? I mean, it used to be on TV, it went to PCs, it went to laptop, and it come to phone now, right? So it's right there with you all the time. So with that particular thing happening, innovation has become a lot more important today in terms of providing the same service in a more efficient manner, in a more personalized manner to the same consumer. So of course, innovation remains very important. But also what remains very important is all the fundamentals of business. Every business that you create, you have to find a consumer. Every business that you create, you have to find a paying consumers. And every business you create, you have to find a paying consumer who pays more than your cost, right? So the basics, the P&L has to make sense, right? And for that, so we are in a very unique situation. We have to basically ensure that people are innovating now and working on that. Of course, we should innovate, but we also should make sure that at the same time, we're also focusing on business fundamentals. What we teach in colleges like yours, and we show that people are very, very strong with their foundational skills, and of course on top of that they create how to use those foundational skills using technology, using innovation, how to solve the business problems in a more effective and efficient manner. So they use technology, they use idea, they use innovation, but fundamentals also are equally critical. That's why you see 90% of the new businesses don't survive also, because they don't find a paying customer profitable thing. So that I think both sides have been focused on, worked on at the same time.
And a last question for our audience. So as you're already an active mentor to a lot of entrepreneurs and also board member and advisor to a lot of companies, what would be your advice to the new entrepreneurs or aspiring entrepreneurs?
I think my advice to people will be that India has never been in a more advantageous situation, right? I mean, we have never been in a much better position than what we are today, right now, right? And so people, if they want to take risk, I think this is the right time to take risk, because the fear of failure and the cost of failure is very, very low today. It was very high earlier, 20 years, 30 years back. If you failed at something, it was taken as a stigma. Today, people have worked in startups and have built startups, whether it's succeeded or not, is taken as the biggest skill actually. That's something which helps you a lot. So I would say, take the plunge. If your heart is into trying something new, go for it. And I think the pace of innovation, the pace of change, the space for entrepreneurship will increase multifold in next 20, 30 years in this country. and time to take up that is time to go for it, and go fearlessly, learn as much as you can, build what you want to build, and let the consumer take care of everything else.
Whoever was last follow-up question, because I'm pretty sure the audience, a few of them would have this question, that how do they reach your level? And I mean, how did they achieve your level? And how do they manage it effectively? And how will they sustain it?
I think if you ask me, maybe you are asking what has been my go-to trick actually all along. So I think for me the most important thing is that as we start building our careers, as we start building our journeys, the single most important thing at least I have seen is consistency. So you have to basically show up. The most important thing I find for people is that they should just show up. Actually, the most important thing is to basically, you will go through setbacks. There will be good days, there will be not so good days, but you have to get up and show up every day. And everything plays out accordingly. But the most important thing is to be consistent with whatever you take up. There will be highs and lows, but consistency remains the single most important.
True words of wisdom. Thank you, Vaibhav, for sharing your valuable insights and your experiences with us today. Your journey has been really, truly inspiring and enlightening. We appreciate your time and look forward to seeing what you're meant to strive and innovate in the healthcare industry. Thank you.
I believe that this podcast has been an excellent learning experience and emphasizing that following your passion combined with a well thought out strategy can lead to success. Don't forget to like, share, and subscribe to our official channel at GIBS Business School, Bangalore. Follow us at GIBS IRE Talks and GIBS Business School on all social media handles to stay updated on the news and updates regularly. This is your host Abhirup Mitra signing off. This is IRE Talks powered by GIBS Business School, where innovation meets inspiration. Thank you.